Hello, everyone. Hopefully you know by now, but I'm Alexis Davis. I'm a social media manager here at RSDSA. I'm joined by Jim Broach, Executive Vice President and Director of RSDSA, Dr. Brandon Yuenger, and his patient, Taffy. In 2012, Dr. Yuenger graduated from the University of Michigan-Flint with a doctorate in physical therapy. Shortly thereafter, while working with a local rehab hospital to rehabilitate pediatric chronic pain and head injuries, he developed a taste for neurologically, based manual therapies and found excellent results with both children and adults. From there, Dr. Yuenger entered the complicated world of chronic pain. Using a combination of mentoring and intuition, he has developed a system of rehabilitation that is based in the understanding that we as people are not a collection of individual parts, but one integrated unit of being. He is excited to share his passion through both practice and education. Now, please remember, while the information shared here tonight is helpful, we always want to remind everyone to consult their physician for personalized medical advice. So before we turn this session over to our guests, I do have a couple of announcements as I pull up our information for our upcoming walk. So many of you know that we have an amazing in-person walk in Long Island each year, but of course, due to the pandemic, we have been unable to have our in-person event. So for the last, just last year, and then of course this year, we are going to host a virtual walk where we invite people to walk in their communities with their family and friends, in a safe manner. Of course, we had some folks who, participated, in their homes by wearing orange, by taking pictures and showing on social media. So we are just excited to have our virtual walk again this year. It's going to be on Saturday, June 26th. And of course, we invite people to register, to donate, to sponsor. And I wanted to make sure that I was showcasing information from our incentive program, because we do have gifts for those who raise a certain number of funds at each level. So I just kind of wanted to showcase this. And of course, we will post it on social media, send it out in our newsletter, and also make sure that we're posting it in rare form. But for more information on the walk, you can visit rsds.org/walk. Of course, you can send us messages, send us emails, and we will make sure that we get information over to you. And outside of the incentive program, we also do have walk shirts that are currently on sale for $25. And before I turn it over to Jim, just a quick note that we are always looking for warriors to tell their story on the RSDSA blog. So if you are interested in telling your story, please make sure that you send us an email or send us a message. We will send you a blog template and we will get your story shared on our website. That's all I had. Jim, do you have anything else?
I just wanted a warm welcome to our returning warriors and any new warriors, and just happy Earth Day. We're really glad it's an exciting day around America, and we're glad that Dr. Brendan and Taffy are here. So Alexis, thank you.
All righty. Well, Dr. Yuenger and Taffy, we are going to pass the ball over to you to discuss all things physical therapy and CRPS. So here we go. Thank you.
Thank you. Well, so I'll start. My name is Brandon. You heard a little bit about my past, and I've just come to find that chronic pain is a really complicated thing. One of the biggest issues that people will run into, especially when they first start to have some pain, is that we think the part of us that hurts is broken. And most people, by the time they've gotten a complex regional pain diagnosis or an RSD diagnosis, have started to have some awareness that it might not actually be the part of the body that hurts. There might be something else going on. And so the general way that I tend to approach patients with complex regional pain, or really just complicated pains in general, is a whole person, mind, body, spirit perspective. So you obviously can't ignore the body. That's something that hurts. We need to investigate what's going on with the tissues. And we find that our mind can be equally involved, as that's just another function of our nervous system. So typically the way that I look at pain is that it's an output of our nervous systems. Maybe some of you have heard about that before, but basically what our nervous system is doing is taking all of the information from our body as well as our environment, and it's comparing both of those sets of data to our past. And depending on what your past has been, we're determining whether or not we're in danger or under threat or not. And oftentimes when we are perceiving threat, we will have our sympathetic nervous system ramps up and we can become anxious as well as painful. If anybody out there feels like they have pain when they get more stressed out, this is exactly what's happening. And then oftentimes the anxiety makes the pain worse and the pain makes the anxiety worse. And we end up in a pretty awful spiral that can be hard to get out of sometimes. So like I said, that's my current understanding of pain is it's a gauge of threat in our environment. And so what we need to be doing in order to heal a lot of these complicated pains that start from the nervous system is to be looking at our history with injury and trauma. And that's not, sometimes people think trauma and they think I don't have any of that. But we're not necessarily talking about like if you were kidnapped and beaten and things like that. Trauma can be something as seemingly small as like a young child or an infant that needs food and isn't getting fed, or needs to be held and have some physical affection and isn't receiving that. It's anything that teaches us that the world that we live in is a potentially dangerous place. And that's when we start to ramp up our fight or flight, our sympathetic nervous system, to be able to protect us from potential danger. And so there's a lot of different methods that we can use, and that I think we'll talk about after Taffy tells her story, to be able to decrease that sympathetic tone, is the way we call it, like a muscle tone that's tight, has high tone. So a nervous system, or a sympathetic nervous system that is high tone, is very anxious and jumpy and oftentimes painful. So if we can bring that down and bring up the rest and digest, which is the parasympathetic nervous system, to find maybe a more healthy balance, we tend to be able to be more resilient and have less pain. So we can talk about more of that in a second, but to start, I think it's important to be able to talk about what the patient, what the person who's experiencing these complicated pains goes through, because a lot of you out there will be on different points in your journey. So the next thing we'll do is Taffy's going to start talking about what her journey has been. And I find that her story tends to be a typical one. And I would imagine that people out there will be able to resonate with at least one point. Maybe it's very early on in the story, maybe it's later on, maybe somewhere in the middle. But so feel free to ask any questions while we're going. We'll try to answer those as they come in. Yeah, and in the meantime, Taffy can take it away and tell us how her journey with complicated pain began.
Hi, I don't know if I'm on the screen yet. Am I on screen?
Yeah, you're on screen.
Okay.
Yeah.
Sorry. Hey there. So my story started off with getting into a car accident. I felt like it was a minor car accident, but looking back, of course I think it was more serious than I thought about. I was just looking at like the car and I was like, oh, it's not that bad. I'm not that bad. But instantly during this car accident, my legs started burning really bad, but it was so much stuff going on. I wasn't really like paying attention to it. I'm like, oh, my leg burns, trying to kind of dismiss it. I'm in shock from the accident. So from there, it just spiraled out of control. Later on, I found that I had more injuries that I didn't feel during the accident. So later on that day, and the first couple of days went by, my back started hurting, my arm was hurting, my head was hurting. I ended up going to the emergency room and had whiplash and sciatica. And then I went over to my doctor, who was like, well, we're just going to put you in physical therapy and we'll help straighten all this out. So for about 6 weeks, I'm put into physical therapy. At this point, I'm not able to move. By the time I get to my doctor a week later, I literally can't get out of the bed without like dragging myself. I remember it took me like about 3 hours to just get to the hospital at this point. And this is about 3 or 4 days after the accident. But fast forward, I'm put into physical therapy, and I'm thinking of the doctor's recommendations. This physical therapy is going to help you straighten it out, get your muscles back. You're going to be fine. Start feeling better in about 6 weeks. I also at this time ended up getting a referral for the ankle specialist, which I didn't see until about 6 weeks out as well. Halfway between seeing the ankle specialist and I'm gonna say about 5 weeks into physical therapy, my pain got worse. So at this point, the whole left side of my body is just hurting. I can barely move. And it seems like the more I'm moving, the more I'm exercising, the worse it's getting. So I go back to my doctor and I'm like, this isn't a normal pain. This is like kind of crazy. Everything is hurting. Everything is burning. Like I have all of this other stuff going on. And it's at this point, the doctor's just like, yeah, it's just a car accident. Just keep going to therapy. And I'm like, no, this is not normal. So I end up going to the ankle specialist who is like, okay, well, you have this plantar fasciitis thing and a ligament tear or sprain or something. But I was like, this is not a normal sprain. So throughout this whole process, I was trying to convey to people like, this is not normal. Like this pain is unbearable. It's crazy. But they kept doing what they knew what to do. Go to more physical therapy, take your pain meds, exercise, do this, do that. So I continued on thinking maybe it's just me. Maybe, it's all in my head, but it got worse and worse and worse. And so at this point, and I'm sure I've heard this is a lot of people's stories, you end up on this whole journey to find somebody who will listen to you. So I ended up going from there to another doctor saying like, this pain is unbearable. I have all these other symptoms. I'm blurry. I can't think straight. I need some help. I get sent to a MRI, which found other injuries on top of like just the leg and the back pain. So at about this point, it's been about 4 months and I'm still not able to fully use my left arm from with my whiplash injury and my leg. And as I'm going on through the therapy, I'm finding that like my muscles are getting smaller. Even though I'm going to therapy and I'm using this, it's getting weaker and weaker. So this went on for about another 4 months. So to kind of sum it up, it took me about 8 months to find a doctor who treated me as a whole person and kind of listened to everything that was going on. And the doctor was like, let me get your records. Let me look over everything. And she called me in and she said, well, it looks like you have CRPS. And I was like, what is that? And she's like, it's this pain cycle. So we're going to get you into a rehab to help break that pain cycle. And instantly, I was just kind of relieved that somebody knew what was going on and it made sense. So of course, what everybody does, you go home and you Google it. So I Googled CRPS and it's like, oh, the only cure for this is prayer. And I was like, oh my God, not that prayer is not a good thing, but it was just so many morbid stories about living with this. And so I did more research and more research. Eventually I got into a rehab clinic about 4 months after I was diagnosed. And at this point, this is a year after my accident. And at this point, I think all the other therapies, even though they were like medically prescribed, they weren't working for what I was dealing with. So I ended up with a team who was specifically focused on neurological disorders and CRPS. And it started off pretty good, but somewhere in between there was this push through the pain instead of just like taking it steps at a time. And I became really frustrated with it because after a year of dealing with this, I was like, I started to feel some relief, but at the same time, it kind of went to the left. So I ended up going back to my doctor and said, well, this is where I am. It was working. It's not working. It's making it worse again. And that's how I ended up with Brandon, whose approach was very different than all the other therapies. It wasn't, you have to force your body to move. We're going to do this and we're going to do that. Brandon was like, we're just going to help you relax and calm down your nervous system. And he also helped me to understand like why my body was responding to like different things by explaining the sympathetic nervous system. As I look back, right around the time where the pain increased, I remember I was really sensitive to like noises. My kids would turn on the bathroom fan downstairs on the other side of the house, and the vibration from that fan would just drive me nuts. I remember just like looking at the sun and hearing the TV. I had to turn it down because I was just so sensitive to everything. Even though the wind just blowing in my window, it would cause pain. I couldn't have anything touch my leg at the time. And eventually it was my arm. I couldn't have the wind blow on my arm. So I was affected by everything in the environment. And I didn't understand. I was thinking, you know, maybe it's just all in my head. But Brandon also helped me to understand like that I wasn't crazy. And to help me to understand to calm the system down instead of ramp it up. And I think at that point, for me, it was just such a relief to have that understanding of what I was dealing with, what I was going through. And it gave me more of a sense of hope that, you know, I can be better off than what I'd been like 18 months before that. And that's all I have to say. I don't know if anyone has questions or anything.
I will have a couple of questions that I'd love for you to clarify for people. The first one was, you were seeing an ankle doctor because that was where most of your pain was. Is that right?
No. So when I got into the accident, instantly the lower part of my knee down to my ankle, it was burning. And so from there,
As soon as you had the accident?
As soon as I had the accident, I was like, oh, my leg is burning. But, you know, I think I was in shock because me and my passengers were kind of giggling about it. And as the day went on, I noticed that my gait was off. So I was walking crooked. And then from there, I think 24 hours later, this pain had moved up to my back, all the way up to like the middle of my back. Later on that day, the next day, the pain moved up to my neck, my head, and my arm. So by the time I actually ended up going to the hospital, less than 48 hours later, the whole left side of my body had flared up. And so I think I ended up going to the emergency room like 3 times within like 5 days because I kept telling doctors like, this is what's going on. This is what's going on. I ended up at the emergency room, I ended up getting like a couple Tylenol 800s that barely touched my pain. It just made me dizzy and high, but it did nothing for my pain. Went back, same thing. We're going to give you these meds. I'm like, this is not touching my pain. So I just assumed that it was just like, okay, you know, your body starts to heal after 6 weeks and it's going to get better and better. And at this point, I was still hopeful that it's okay, it's going to get better and better, but it went the total opposite. And then at one point, I just remember going to a doctor's office and trying to fill out paperwork, but the clipboard was so heavy in my left hand that I couldn't even hold it. And then my muscles were wasting away. And it was a little bit over time, but you know, I think I missed a lot of that because I was just so focused on where can I go to get the answers to like help me heal.
Yeah, I think that's a super common experience, right? Especially right off the bat. There can be a bit of a figuring out process that can take longer for some people than for others. And honestly, that where I said your story is typical, I feel like you kind of I've seen people who take much longer before they actually get a diagnosis of complex regional pain syndrome. But I wanted to point out about what you're describing, because I think a lot of people are going to run into that, right? So you had, I guess the question is, at what point was it because of this lower extremity pain that you ended up going to like a podiatrist or an orthopedic ankle specialist?
So when I first went in to see my doctor, I was like, my ankle hurts and everything up hurts. And the first thing he said was, well, you got plantar fasciitis.
Yeah, right.
Let's
Got it.
go to the doctor. And I'm like, well, what about all of the rest of this? And so that's how I ended up at the ankle specialist.
Got it. Yeah. So that's something that I would expect a lot of people to run into. And if nothing else from this talk, I think it'd be good to at least hear what some of the experiences have been, and maybe some experiences that I've had, because I'll have people who come in to see me for that first round of physical therapy who are, they've been told that you've got this thing wrong with your ankle. You need to strengthen it and stretch it, and that's what's going to make it feel better. And oftentimes that can make my job relatively difficult because, from a perspective of somebody who treats pain all day, it doesn't behave the same way as a structural pain might. For example, somebody with complex regional pain syndrome is probably going to have pain to the slightest touch. A lot of people can't wear, like if in this situation, if like my foot and my ankle hurt, maybe I can't wear socks, or if it hurts all the way up to the knee, maybe I can't wear pants because just that slight touch is really painful. And that's certainly not something that would indicate an ankle sprain or plantar fasciitis by any stretch of the imagination. However, when we have, because pain is not super well understood, as much as we like to think that we understand so many things, we have all this fancy scientific equipment and stuff. When it comes to our neurology, we don't understand that much, at least as much as we think to. We have had amazing advances, but generally speaking, our medical system doesn't know what to do with pain. So they think where it hurts, that's what's wrong. And especially if we can find something on imaging, like on an MRI or something like that, or even, a lot of our testing is just to palpate. Palpate is just to touch the structures and see if they're tender. And so, of course, somebody who has a complicated pain or a complex regional pain diagnosis, they're going to be sensitive to everywhere you touch. And it's not to say that there's no value in palpation, but typically what I'm going to do is palpate points that have more neurologic activity. And those are points where you might have an acupuncturist put a needle, or some dry needling schools will teach to needle at some of these points, some of the same points that are acupoints as well. And I think that's what we started with Taffy, was to be able to say which one of these are the most sensitive. And we could tell that we were making some amount of progress because every one of them was sensitive. And then that was you, right?
Yeah. So by the time I got to Brandon, so initially it started in my ankle, and it, I guess, affected the left side from the first 7 or 8 months. By the time I entered the rehab program, a couple of weeks into it, my pain had spread full body. So I didn't have this whole spatial awareness. Everything hurt everywhere all the time. And so I think that was a issue when I first came in. It was like, okay, where do we start? And I'm like, I don't know where we start. Everything hurts. And so it took a lot of time for us to just figure out where we should focus on and where we should start. And I think that that's how Brandon used methods to just completely calm me down in order to have that awareness of my own body and where the areas was like really important to me, because at this point it was just like I was a big ball of hurt. But when the system calmed down, I could say, okay, so this area particularly is bothering me today, or this area is bothering me today. And so it also helped me to focus on what areas I should do those small movements in, as far as increasing flexibility.
Yeah, and it helps point out we're kind of well, we can move on to the, I'm thinking about this in my mind as like, here's the phases that people go into. And I don't think that we went in any sort of linear path with you, which is maybe another important thing to talk about, that oftentimes as we're trying to like investigate, you know, like essentially my job as the therapist is to help the person, Taffy in this case, to figure out her own body. And that is not a necessarily like a straightforward, easy task. Okay, we're asking about techniques. Let's talk about those in a quick second. But yeah, so, and it takes time, right? Because this is a complicated thing and we're having a hard time getting answers from the general medical system, who's thinking, okay, you hurt here. That means we need to order an x-ray of that part of your body. So it can be really complicated. And then you have to, once you're like, oh, okay, this is my nervous system, then we can start to talk about how to look at the nervous system, because the nervous system operates unconsciously. And so
Yeah.
I can start, go ahead.
Oh, I was going to say, that was, I think with all healthcare professionals, it's like you said, people don't really understand pain. They understand pain to the level of them feeling pain. And it's hard to kind of convey that to somebody who has never felt pain. And it's not a normal pain like, ooh, I paper cut, I scratched myself. It's like explosive pain. So it's hard to get somebody to understand that your pain is to a point where you don't know what to do and you don't know how to explain that to somebody who's there to care for you. So I CRPS brain fog. I forgot where I was going with that.
That's all right. You know, the other thing, yeah, go ahead.
So I think that's where I was going with that, about like, I wanted to talk a little bit about how people who live with CRPS, like what we experience from the inside. So because there's this whole sympathetic nervous system that is unconscious and you're not supposed to have to think about it, it's gone haywire. So now you become an active participant in all of the things that the nervous system is supposed to do. So, you know, you have this fight or flight situation and your body ramps up, you're sweating, your muscles tense up in order for you to react to the situation, and it doesn't shut off. So now you have all this anxiety because you're always thinking everything is a threat. And this is one thing that I really had a hard time explaining to people. They're, you know, after this, just calm down and relax. And it's like, I'm trying to calm down and relax, but my brain is making me ramp up. So how do I do that? And then also like the rest and digest that you talked about, your body is not resting and digesting, it's going the opposite way. So I remember having to take like sleeping pills in order to rest because my nervous system and my brain was so ramped up that it would not allow my body to rest. It would not allow me to go to sleep. So on top of all of this anxiety, you're not digesting, you're not sleeping, and you have to consciously do this. But because you're burning so much energy, because your nervous system is off, you're doing all of this stuff on a limited amount of time, plus the brain fog that goes with it, because your system is always in a constant state of overdrive, is very difficult. And I think a lot of people don't know how to convey that or to explain that. And then even outside of that, I think one of the hardest things for me was I was a mom, I was working, I had a job, I had a business, and all of that stopped. But life continued to move on. And there are some situations and things that even though I was stuck in a bed, I had to deal with. So that's another level of anxiety that you have to deal with and problem solve. And I really wanted to touch on that because, you know, for caretakers and people who are there for people, it can be frustrating for them because they don't understand what we're going through and they don't know how to help. And sometimes it's okay to not help, but we're not intentionally trying to make situations difficult or be in the situation that we're in. But it's like our brain has unconsciously taken over who we are. And it takes a lot of work just to be who we are every day.
Yeah, it becomes a lot harder to be present when you're constantly in like self-protection mode.
Yeah.
So I think that that's a good feel free to finish what you're saying. I just wanted to make sure we move into, people are asking about like the techniques to use, and I would love to be able, I'll share a little bit about what I do from my perspective, and I'd love for you to be able to share like your experience too. Because ultimately that's why I ended up here, is because Taffy was like, more people should have access to this type of treatment. So did you have another thought that you wanted to get out before we go into that?
Nope, go ahead.
Okay. Well, so we're talking about calming the nervous system down, and I think great question. How do we do that? There's a lot of different things that you could use. But I think the main one that's the most important is breathing. And there's a wide variety of breathing techniques that you could use. So, for me, all I'm looking for at the beginning with somebody, this is what I usually say at the first day, is if we can feel more relaxed, then that's success for the first day. And what I want the client to do is start to learn how to be more relaxed on a regular basis. And the reason for that is, if you can give yourself an input, like if you can't relax, then that's where I have to help. And we'll definitely talk more about how I do that or to help a person get there. But if you can relax and get your nervous system settled down, even if like you still have pain, there should be a noticeable difference when you become less fight or flight and more rest and digest, which is what Taffy was just talking about, where she's like, okay, now that everything's not going crazy, I can really notice these areas of my body. So breathing, like just belly breathing. So people who are, if there's anybody who's anxious that I'm not getting to the techniques, start letting your belly, I'm going to show you my belly. We're just going to go breathe in, let that expand, breathe out, let it contract back down. Or excuse me, let it just fall back to where it started. Breathe in, let it go up. Breathe out, let it go down. And if you just do that while we're sitting here, that's my first step for just being able to find some amount of relaxation. Because what happens, there is innervation to the diaphragm. Innervation meaning the nerves that tell the diaphragm what to do. They span a decent distance up cervical spine into the thoracic spine, and there's even some input from cranial nerves that can come in and facilitate breathing as well. So we can get feedback to our central nervous system, and with big deep like longer breaths, you start to switch your central nervous system more into, or your autonomic nervous system is a part of the central nervous system, to a more parasympathetic state. Just like if you really wanted to, you could start breathing with your upper chest and your neck and everything, and fast, and then you could upregulate the sympathetic nervous system. So you can use breathing to do whatever you need to do, but most people don't need to get more fight or flight. That's for somebody who just can't get up or something like that, and can't move around. Maybe somebody who's like really depressed, but I wouldn't start with just breathing fast anyway. So we're getting off track with that. But so mainly what you want to do is long, slow breaths, let your belly rise and fall. And then once your body starts to get a little bit more relaxed, then I usually have us go into another breathing. So if you're following along with me so far, the next one's more imagery. And I find that it's a whole body scan, as well as the parasympathetic rest and digest input. But you're going to imagine that there's a hole in the top of your head, like that. And when you're breathing in, you're just imagining that the air is coming in through that hole. And as you're breathing out, you're imagining that it's going out your arms and your legs, like down your spine, out your arms and your legs. That can be step one. I often teach it both directions. So if you really are struggling to calm down, just in through the hole in the head, down the spine, out the arms and legs, in the hole, down, out the arms and legs, and keep doing that. And that'll calm you down faster. But what I really like for people to be able to do is in through the hole in the head, out through the arms and legs, in through the arms and legs for their next breath, out through the top of their head, and then keep going back and forth. And now you're getting a consistent body scan as well as parasympathetic input. And I can't say here's why this imagery seems like it works better, but a lot of people who've tried other breathing techniques seem to really do well with this hole in the head breathing. And so who knows, maybe we need to have some research on if there's something that's different about it. So if anybody out there is interested in doing that research, let's do it. But anyway, so those are the first two like easiest steps that you can do. And when you're doing those breathings, usually people have been experimenting and figuring out what their best position is, where they can feel the least pain when they're just resting. And so you would want to do those breathings in your most comfortable position. If I have to recommend any, I would recommend laying over a stack of pillows with like 4 pillows underneath your belly and just laying there. Because sometimes if you're laying and you're a little too arched in your back, it can be painful. Or laying on your back with your feet up on something, so your hips are kind of up and then your knees are kind of on top of something, like just a laundry basket with a pillow on top. If you're not sure what position to try to start in. I think those are 2 good ones, one on your stomach, one on your back. But of course, you can always be on your side, or sometimes people like to be in a specific chair that seems like it works best for them. Regardless of what it is, especially to start, we're just going to be in a comfortable position, doing some of the breathing. And then you want to just see, like I said, if you can get yourself feeling relaxed, fantastic. If you can't, then we have to do some more things that I usually try to involve more of our senses, because one of the problems is you can't really touch somebody. Like lots of times as a physical therapist, somebody comes in there in pain, we're going to put our hands on them and start to move their body around and see if we can help release the tension that they hold within themselves. But when the pain is more coming from an increased sympathetic, like self-protection mechanism, it's really hard to do that, because everything can be perceived as threat, like even the lightest touch. I'm sure people that are watching this have experienced that, and probably experienced it day in and day out. So we need to be able to start more with, like I said, with our other senses. So I find that there's some music that I really like to use, and I'll use a different song, like different tracks for different people. Depending on what their body is telling me. So I have some that will bring our awareness more to our neck or our head, or towards like our heart, or down into our lower body, depending, like I said, depends on the person. And you can find all kinds of stuff like that on YouTube. If you search for like solfeggio frequencies on YouTube, you'll find so many different things. And then you can just play around with it. That's what I did to find the stuff that I liked. I just listened to a bunch of stuff on YouTube and like felt what resonated with me. And I was like, these are the things that I will start using in treatment now, because I'm noticing how this positive effect on my own body. And then obviously I kept using them because my clientele was noticing the same. And so things get a little bit more outside of the box from there. But I would like to touch on some things that before we get to the like outside of the box, the even more outside the box than what I was just talking about. We should probably talk about I can't remember exactly what the protocol all fits under, but it's the fellows from New Zealand and Australia have come up with a complex regional pain syndrome. Like here's what we need to be doing. And it's not all these exercises and stuff. It's more of a retraining our brain. So, and I want to go through the basics of that, because anybody who's been diagnosed with CRPS, if they're not doing these things, they absolutely need to. I kind of take for granted especially during this talk right now, but definitely during treatment, that's something that's going to be the basics. It's like if somebody comes in and they got a bad knee, we're probably going to like gently stretch and strengthen the quads and the hamstrings and the hip and stuff like that. So it's like that for like an orthopedic condition, but more for your nervous system. And so first step, you kind of want to go in order with these two, but the first step is to get the app. Taffy, if you remember, what is it? NOI recognize. Yeah.
Recognize.
The NOI. Say it again.
Recognize.
Yeah. So there's an app and you have to pay for the body parts separately. But so the way that I recommend to use it to get the most for your money is if you have a worst spot. So again, it's NOI and then just recognize if you're searching for it right now, is you don't want to necessarily do if you have widespread pain like what Taffy's describing. you want to start with an area that you have more access to and doesn't flare as easily. Because if your brain goes directly to the area that's more easily flared, you're asking for more flare. So like for Taffy, I think we identified that her neck was the easiest place to go in. Like she would feel more relaxed if we did like work with her neck, even into the arms and the legs and the back and stuff like that. Is that accurate? Am I remembering that correctly? Yeah. So for her, I would be like, let's do the NOI recognized for the neck. And then if we can get some of that pain to move down here, maybe we can do something for like the spine or the shoulders or something like that, or elbows or hands, right? Because the worst pain started, we usually work our way towards the original pain. That's my experience anyway, because that one's usually the worst wherever we started, or whatever came on first and then spread elsewhere. So you definitely want to be doing that. That's something that you can do all the time, do it multiple times a day. And what it's going to do is show you just left and right. And forgive me, I don't remember the exact words for how this happens, but that crossing center line is very valuable for desensitization. If anybody's ever heard of EMDR, it's a mental health technique for reprogramming trauma. They do the same thing, whether it's sound or a light bar or touch. We're going left, right, left, right, left, right. So what this app is doing is showing you the left, showing you the right. You're trying to choose on the app if it's a left or a right. And so what's happening is your brain is starting to get a more refined view of its view of your body. So that when the information coming from that area shows up in your brain, the part that's processing it, it's going to be less sensitive to it. It's going to understand it a little bit more. So it's not so much of a threat. So that is a very important thing to have. There's a lot of different movement you can take, but like I said, gradually starting away from the pain and moving towards where the worst pain is, I think is the best way to do it. And there is a progression within the app itself where you're going to go from like really easy stuff to maybe a little bit more complicated and then into like abstract, almost like drawings. And so the more abstract it is, the harder it is for your brain to process because it's less normal, but it's a good thing. It's an excellent way to desensitize. And typically after somebody's started doing that, the next step that you want to be thinking about playing with getting into is desensitization. So that's taking something maybe that's really soft and just touching the part. We're going to say, for example, my hand is what hurts. So we're going to have something really nice and soft there. And just being like, this is a nice, gentle thing. Maybe it feels awful to you right now. I don't go directly to, again, the more painful parts. I try to get people's nervous system calmed down and then let's reassess. And the areas that are still jumping out at us, then maybe we go to those areas. But I think it's also important to note that if you go to the opposite area, so if like I'm saying that this hand is what I need to desensitize with like a cotton ball or something, that this other side might be the smarter place to start, the smarter location to start, because you can feel, oh, that feels like a nice soft cotton ball. And now your brain has that information, and then it can start to compare that information to the information that it's going to get from this other side. It's like, oh, no, that doesn't feel the same. So let's go back over here and be like, here's what it feels like. And then let's try again. And here's what it feels like. And then let's try again. But giving your brain the just consistent input so that you can be like, oh, we can start to retrain this. And this is stuff that you could be doing. Like I said, you could be doing this every single day. And like I said, you start away from the worst pain and move towards the worst pain. And then the final step of this type of protocol is the mirror therapy. And I've had people who have big flares from doing the mirror therapy too soon. So you definitely don't want to do that too soon. That's something that can be like more of like you got to wait for it. So don't jump into that too soon. But essentially what you're doing is putting if it's just a single limb that you have, you put a mirror up so that it's reflecting this, right? But my mind is seeing, it's hard for me to describe right now, but imagine there's a mirror here and it's reflecting my fingers. And so if I'm looking at it this way, my brain is seeing two hands. So it looks like this, but really there's only one up. And so if I'm looking at that and I'm just doing these little bits of movement and stuff, you might even feel pain in the side that's not moving, that's just hanging out, because your brain's trying to figure this stuff out. It's like, what's going on? That thing's moving, and that's bad news. So again, so many different things that you can do as a progression through that. But those are the three major components, along with just mental rehearsal. It's called graded motor imagery. So you're just imagining movements, and then maybe after imagining, you can start to do a little bit on one side and then maybe the other side, but you kind of have to take it as your body allows. And like I said, calm the nervous system before you do that. That's really important. Do some of that breathing stuff before you get into that.
Can I jump in right quick and something about that? So normally I would just like to stress, because for me, this was a challenge to all of this therapy, is that it was slow progress, and it takes a really long time to just accomplish one thing. I remember just going and taking a wet towel and putting it on my arm or leg and saying, well, this is what a towel should feel like. But it took me about 12 to 14 months after the accident in order for me to be able to like tap my leg with a towel and say, this is how it's supposed to feel. So I just want to encourage people, it's not a quick thing. It's really slow. You take a little bit every day and every day and every day. But for me, I just want to note that I was frustrated because I expected something to be quick and fast and more progressive, but because you're dealing with the nervous system and it's a whole different ball game, just take your time and, have grace for yourself in the process.
That is an excellent point. We all could handle giving ourselves some grace. We're in a very go, go, go culture. Yeah.
Yes.
Yeah. And so, yeah, a lot of I think what you're talking about is that we get this like, oh, now I have a diagnosis, so now I'm going to get the therapy for the diagnosis and I'm going to get better. But a lot of times the diagnosis, just generally speaking, like sometimes it gives us a lot of good information, but with pain diagnoses, it's just like, here's what we call what you have. That doesn't mean that we know how to fix it. But there definitely, we have to take this whole person approach, I think, to be able to actually have a resolution. And the resolution can definitely take a lot of time because, our nervous systems are as complicated as what our history has been. So, the more like say bad things that have happened in your life, the more protective your nervous system is going to be. If you've had a relatively stable, comfortable life, then it's probably going to respond a bit quicker because it's less protective. So everybody's different. By the time you get a complex regional pain syndrome diagnosis, you can at least know that there is hope for you, but you definitely have to advocate for yourself and see if you can get like let's get into the right thing right now. Because, and I want Taffy to talk about this a little bit more too, there's like a mentality that if somebody doesn't understand all these things that I'm saying, that the message that they give out, even if it's not the words they're saying, is this is all in your head. This pain is imagined, it's not real, but the pain is very real. You're experiencing it, you're just making it up. Like you'd want to just suffer. Like maybe some people you can't fake, like some people, maybe they're trying to get drugs or something like that, or whatever. And somebody's faking it. I haven't seen somebody like that in a long time. It's really easy to write somebody off as, they're faking it because I can't figure it out. So they must be a liar. And that's just a reflective of an ego that's trying to be the healthcare practitioner. So I know Taffy has some experience with that. And I think we should save a couple minutes because I wanted to touch on some of the more metaphysical things that we've done too. But if you want to talk about that a little bit, like what your experience has been with people saying it's all in your head, I think that'd be good.
So, when I was trying to convey this, but, due to my situation, I was aware, but at the same time, I felt like people weren't fully listening to me. And so when I would say it, they would assume that, yeah, maybe she's tripping. So I was never a person who was like, I had to take medications daily. I was, for the most part, healthy. I exercised a lot. So I had a good medical record, I feel like, before this. So when I came across this, I felt like there was no reason for anybody to like doubt what I was dealing with or going through, because it wasn't in, there was no history of it. And so by the time I got to my third or fourth doctor, it was just like, okay, this stuff is still going on, but they were kind of looking at me like it's in your head. And even when I went to a therapy specialist who specialized this place specialized in CRPS, when I got to the point where he had spread full body, I was like, oh my God, like everything hurts all the time. My ears hurt. At this point, my eyeballs were hurting and everything was hurting. I was even told that it was a pain exaggeration. And I'm like, how is that a pain exaggeration when everything hurts? It's not in my head. Like, I'm literally hurting. So for me, as I ended up with Brandon, it was a lot of having to unlearn. Now I'm getting to the point where I'm in this arena where people are actually not only understanding me, but they know what I'm talking about and they know how to do it. So that was great for me because it was like, I'm not crazy, and that's another level of anxiety or something that you have to deal with, because I like to call it medical gaslighting. People make you feel like what you're not, your experience is not your experience, like you said, with the ego, because they don't understand it. And they feel like because I'm the medical professional, I know better than you.
Yep. And very rarely is that the case when it comes to a complex regional pain syndrome diagnosis. It's just complicated and tricky. So it's like, for me, it's like, don't be ashamed, but educate yourself, if it seems like you don't know what to do with this stuff, because chronic pain is increasing as the years go on. I remember it's several years ago that I was reading statistics about surpassed obesity as the number 1 epidemic in America. I'm not sure what the current statistics are, but that's bad news. That tells me that there's like a systemic issue. We're not gonna get into all of that right now. We're certainly not gonna solve that today. But I would like to, let's spend a little bit of time, because let's finish up with the techniques. That's our one question and we're running out of time here. So the last physical, right? So we were talking about some physical stuff with the desensitizations and the app and the mirror therapy and stuff, which you can call those like physical and a bit mental, because we're talking about like how to reprogram our nervous system. One thing that's important to do, and that we didn't touch on, that everybody can do, is to getting your heart rate elevated, like 10 or so minutes a day. The American Heart Association says 20 minutes a day, but just to get some blood flow to our nervous system, just elevating the heart rate a little bit. So everybody needs to be able to find their own way of doing that. And that can be difficult because it's not necessarily like, maybe walking doesn't do it. I think a pool can be helpful. But even just like, if you can only use your arms, right? You can dance, however much you can dance, you can do it. That usually releases some dopamine too, and you can feel a little bit better. So I wanted to make sure we touched on that. Getting the heart rate up and breathing are things that everybody can do, as well as the app. You can just get that, like right now, you can get that, and you can have some cotton balls and washcloths and stuff. You can desensitize. You can start with some of that stuff right now. Super important to be able to have somebody guide you through it, because it is complicated, it is tricky. I've never met or heard about anybody, unless there's somebody out there, or maybe Jim and Alexis know somebody who's negotiated this space by themselves. It's just so hard to do. So anyway, then the other things that we want to do, we start talking about, because we talked about mind, body, spirit. There, you're back. The mind part, I always encourage people to have, at the very least, to have mental health support, because this is a trying thing. Like, the process of having complex regional pain syndrome is a trauma within itself. So I tend to refer to trauma-informed mental health therapists, especially ones that I mentioned EMDR before. I find that that's a very valuable technique in desensitizing your nervous system. And it's not a step that everybody takes, but it's very important. And I think it just comes with time, as people start to understand, how emotion can play into a pain presentation. Then they start to see that it can be a valuable thing to add that piece to the puzzle. And I think if that was more of the convention, that people would have more success with complex regional pain syndrome. But that's not the current state of affairs, but hopefully by doing talks like this, we can start to trend that direction. So we talked about physical, we talked about mental, and then the spirit. And this is where people's belief systems can kind of get into, come into play. And so for me, bear with me, I might not say the right words, but there's a portion of us that is hard to make tangible, but is very real and can manifest itself in a lot of health conditions. So one of the things that I had the pleasure of learning was some of the indigenous healing techniques of the Caro people that live in the mountains in Peru. And so I have taken what I learned from that and turned it into like a step-by-step meditation that I find can be really valuable once the nervous system is calmed down, to be able to access. So I'll use Taffy's example. So we've got the nervous system calmed down a little bit, but now these spots, we just have some lit up spots instead of having everything be a whirlwind. There's some spots that are like a little bit more active. And so what I find is by going through some of these healing methods that have been going on well before our modern Western healthcare system and science came along to say that those things don't exist. If we can use some of that stuff, then we can gather more information about our nervous system. So people might think that I'm crazy for saying, like, if you know, Reiki is the most common technique that I think people know about. And so I think that can be very valuable. And my experience has been with folks with complex regional pain diagnoses, that when we do stuff that is not touching so much, but can be more like we described sound, but also using smells. And at the very least, you can just play around with different smells that you like. And you're paying attention to how they affect your nervous system. So like I just have some oils that I have smell. And I think essential oils get a bad rap because there's people out there who say, well, this is going to heal this condition. And I just don't think that really works that way. And maybe some people do have good success, but I do find it valuable as an input to our nervous system. So when we smell, since we've been talking about so just checking the time. So when we talk about like, how can a smell be helpful? The smell, the olfactory bulb, which is back in our brain, butts directly up to the limbic system. So hopefully this makes sense based on everything else that I've been saying. The limbic system is our emotional processing. And so when our limbic system starts to light up and is sensing more of like a danger, and we start to get like our fear response going, then the hypothalamus is what starts to dump the stress chemicals and gets our body ready for fight or flight. And the hypothalamus is directly influenced by the limbic system. The limbic system also directly influences our anterior cingulate gyrus, which it processes both pain and depression. So we can influence the parts of the brain that are part of the processing of pain through smell, and also taste. And also we talked about the visualization and through sound and all this kind of stuff. And touch can be the hardest one, right? Because sometimes it's so sensitive to touch. But so if you can play around with that, and you can get an idea of like, what does my nervous system seem to like? Which ones help me feel like, whew, there's a weight lifted? The obvious one that people are always like, I like lavender. They say I like lavender a lot because that tends to be a calming one. But I say play around with them. If there's even a candle store or something like that, artificial scents could potentially make you feel like more painful and have a flare. But so I tend to stick with more natural things. But I'm sure in Taffy's experience that I have a big box of oils, and we just kind of go with like what seems right in the moment for each person, in combination with the meditation, in combination with the music, and then in combination with the, like I said, with the indigenous healing techniques that I've learned over the years, which I think are the most interesting part of all of this, because somebody with a sensitive nervous system, and I can comfortably say that everybody that I've met with a complex regional pain syndrome diagnosis has a very sensitive nervous system. They sense the subtleties that exist. So once the nervous system can calm down, to give somebody with a sensitive nervous system the opportunity to be able to perceive what else is going on, like that's a super important part. You kind of have to kind of clear out the cloud so that we can kind of see through it, right? And then once that cloud's gone, then people can start to be aware of these more subtle things. Like even, I swear, like just a change in pitch, or sometimes I use like tuning forks. And so I'll use a tuning fork and people can feel that at different spots in their body. And it's remarkable to witness. And I don't necessarily have like, here's a peer-reviewed placebo-controlled double-blind study to say, this is why a tuning fork might be helpful for this person. All I know is anecdotally, and my experience shows that things that aren't directly touching the body they're an input to our nervous system, but they're less likely to be a threat. And we have to find out what isn't threatening so that we can start to re-educate the nervous system. Hopefully that stuff makes sense, because I know sometimes we get lost. But any other questions, we're happy to answer. Any thoughts on that, Taffy?
No, I was going to mention the tuning fork, which was like really cool because you can actually feel the vibration. It's like the vibration of the tuning fork kind of like rushes through your body, and it's
not touching you, right? It's just in the air.
No, it's not.
Yeah.
No. So, the nervous system responds to our outside, what's around us. And it's cool because even just the sound, you can, like how I was talking about how the fan just drove me nuts, the vibration of the fan, the tuning fork helped to calm me down.
It's just got to be the hard part. And this is where like I just should develop like a course or something, assuming that there's enough people interested in it to take a course, but where you can say like, here's how you can help figure out what that person needs, right? Mm-hmm. Because in a healing profession, I will always say, who knows if anybody agrees with me, but there's an art as well as the science to it. And we need to be proficient in both the art and the science if we're gonna be true healers. And so that's more of the art, is to be able to sense what's going on, with that individual person. Looks like we're running out of time. Any closing thoughts? I think I've said everything I need to say.
Me as well.
No, Brendan, you were hitting your stride. I thought that was great.
Thank you.
Definitely. So you did answer a lot of the questions that we had just about technique. I think that was the biggest thing, some folks were definitely asking about. But one question that we had about, the breathing exercises is how often and how long would you recommend CRPS warriors, go through those breathing exercises?
So the answer that is going to be based in your body. I try to, being a realistic person, I ask people, the more complicated it is, the more times a day I ask them. So lots of times people have a hard time making time for self-care. So I'm like, let's start with once a day. And so people will choose nighttime usually, especially because if they're in pain, they're struggling to sleep. And I say, great, fantastic, you did that. Now let's do one during the middle of the day. But I'm thinking morning, noon, night, and when you go to sleep, because if you're the more, like I said before, the concept is neuroplasticity. And if we can, to make a neuroplastic change, what you need to do is get a frequent, consistent input to be able to make this new pattern happen. And so that can be tough, right? So if you do the breathing and you did it for, and I would also say, I tell people, give yourself a half hour. And people are like, a half hour? It's like, well, it's not that much time. If you just make sure you know what you have to do. But also if you have complex regional pain syndrome, you probably need to be pacing yourself even more so than the rest of the people, or than other diagnoses like a fibromyalgia. Doesn't necessarily need to pace themselves as much as somebody with complex regional pain syndrome. So every time you're taking a break, do it. That's what I think. And the more times you do it, the more you flex that muscle, the more access you have to that muscle. And it becomes natural. I've had people that's like, I just catch myself doing it now, and I'm living, I used to live here, now I'm living here. So the one answer is shoot for 3 times a day. If you're not doing it every day, you're not changing anything. The daily practice is super important, and that goes for everybody. That's not just complex regional pain syndrome. That's everybody. If you want to make a change, you have to have a daily practice. But then the more complicated answer is when your body needs it, and you have to be aware. And it's really hard to be aware when you've been, your survival skill has been to dissociate from your body and not pay attention to your body because it's constantly in pain. So how could you stay with it? And so that takes a little bit of time sometimes, and therapy. It takes it takes doing the work to be able to stay with your body and know what to do and feel confident with it. But like I said, there's my long answer.
And we definitely had a question about, I mean, of course, a lot of questions about techniques, but we do have a question from someone who was saying, you know, are your techniques, or excuse me, do your techniques do more for skin or bone sensitivity than nerve pain? Can you like maybe touch on that a little bit?
Here's my guess. So I would be asking a series of follow-up questions to that person to understand what they mean, because every pain that we feel is from our nerve, like it's from our nervous system. It's a output of our brain based on what's going on, but it can feel deep, like it's a bone, or we can feel like it's up on the surface of the skin. And so if somebody's talking about like anybody, if somebody's poking on your bone, somehow they got that deep, it's going to hurt. But if you're talking about skin sensitivity, like where it's just like a really light touch, we're still talking about the nerves. We're talking about a hypersensitive nerve. And what's happening in all of these situations is that depolarization is what happens when a nerve fires. There's chemical binding to the neuron, and when enough chemical has bound, it sends an electric signal to communicate to the next nerve. So what you're having when you have this light touch is that these are not needing a lot of chemical binding to fire. The depolarization happens really fast. So it's the same answer, because we're saying calm that nervous system down. Let's get this thing to not fire as frequently. So hopefully that makes sense. Unless we're talking about like somebody had a fracture and they're feeling bone pain or something like that. But so that's my best interpretation of what that question is.
I know you also mentioned, you know, trying to have like an elevated heart rate. And so we had some, you know, people, because, you know, we unfortunately do have some CRPS warriors who, you know, they cannot stand up for a long period of time, or they, you know, cannot walk. So what exercises do you recommend for those who have CRPS in their feet and lower legs, or just, you know, in their legs in general?
You know, the first thing that comes to mind, because there's a wide variety of things that you could be doing, because you're thinking upper extremity, you know, anything that you can do, like if you're in a physical therapy office and you can sit, you could do, it's called the arm bike is something that's pretty easy. But like I start to think about Richard Simmons, and I can't remember what his stuff was, but you see the videos where he's taking somebody who, and they can't get up and walk because of their weight, but it's still the same type of thing. It's like they start with just clapping along to the music, you know, and if that's all you can do, great, we're starting to do something. And then you can just be here, you know, or just get our heart rate up in whatever way that we can. And then from there, you can start adding weights and make it more complicated and whatever else you might need to do. It's but you just open that up, like what can you do? Then we got to work with that. And that's really better to have an evaluation from a physical therapist, so they can say, okay, you seem like you can do this, so here's what we're going to build for you to be able to get some of that cardiovascular training.
Jim, do you have any questions? We have a few more, but I wanted to make sure you can jump in.
No, I thought it's wonderful. For tonight was the first time I really thought of the graded motor imaging for whole body pain rather than just a limb, because so often you hear it about just a limb. And I thought that was an aha moment for me, to really focus on part of your body rather than whatever you wanted, away from what's really flaring.
Yeah, I think it's important that we're creative, because you see, there's so many tricks. Like, I mean, the more you work with people with complicated pain, you know, you have to be able to think on your feet. And so if we can just understand like what this is doing, like neurophysiologically, then we can start to apply it to different situations. And that's just, you know, like I said, maybe we just need courses and stuff in that. And there are courses, I just don't know the names of them right now, but it's the guys out of New Zealand. They got a lot of courses.
Yeah, I think they would say they're from Australia.
From Australia? I'm thinking about Butler and Mosley, who did all the research.
They're Australian.
Are they from Australia? Oh,
Yeah.
Sorry. That'd be great if they were watching this. Sorry, guys.
Well, one of the last questions that we have is about neuroplasticity, and if you know of any experts, you know, in that realm, or people who are just, you know, of course, very knowledgeable in that realm.
who know about neuroplasticity?
Mhm.
Well, neuroplasticity is this concept. So I don't know that you would, if you're like thinking about like, I have my PhD in neuroplasticity. I've never heard of anything like that, but
Yeah, the question was,
it's like,
are there experts in it? So maybe there aren't.
oh, you know, I would say mainly like mental health experts, physical therapists, occupational therapists, any sort of therapist should be good at working with neuroplasticity, because that's the basis for change, the fundamental change in our nervous system. So essentially, we don't spend like in school, we don't spend a lot of time being like, here are all the facets of neuroplasticity. We're like, here's the concept of neuroplasticity. Now put it into all of the things that we're going to teach you. It's something that we learn really early on, is that the nervous system can change and it needs to be a frequent, consistent input. But now we just have to figure out how to make that input for that person. So long answer short, pick a therapist. They should be an expert in it, but it depends on how they think.
Alexis, we had a couple of good videos earlier in the pandemic with Dr. Peter Abachi. He really spoke about the neuroplasticity in his 5 ways to better health. And also Melanie Levine, our first person who is a psychologist, and who I'm asking her to come back for Mental Health Month, because it's so important.
Definitely.
Mind, body.
I'm really happy that you mentioned, mental health, because May is Mental Health Awareness Month. And so late last year, and we were asking our warriors, like, what do you want to hear about? Who should we bring on? We definitely had a lot of, responses about mental health and, just how to deal with CRPS. I mean, it has a lot of different things going on. So I'm really happy that you mentioned that part.
Yeah, let me know if you want anybody to talk about like trauma-informed therapy and EMDR and stuff like that, because I have friends who do that. That was one of my missions that just kind of showed up at my door, was to find the people in my area and see who takes what insurances, because that's obviously a big barrier to getting some of this care.
Actually, Brendan, we're looking for someone to write for our digital newsletter on EMDR. So
okay, perfect. Yeah, there's a couple people. If there's any way you guys could send me an email or something, maybe I could forward to those people, that would be.
Yeah, definitely great. We'll do that. Yeah, that's great.
Follow up before we're done, but I think that we are wrapping up. So of course, I just want to thank you all for this information. Thank you for joining us, Taffy. Thank you for joining us, Dr. Yuenger. This has been great. So for everyone watching, of course, this video will be pinned, to the top of our Facebook timeline. So you can, of course, rewatch this over and over and over. And we have so many other videos, of course, from past Facebook Lives that are there as well. We will also be adding this to our YouTube channel for any friends or family members that you have that do not have Facebook. So be sure to let them know. And of course, if you have any questions about our upcoming walk, our upcoming Facebook Lives, our next live should be on May 13th. More details will come out about that, in the next couple of weeks. So, or next couple of days, I should say, because May 13th will be here before we know it. We also have tons of information about physicians in your area. If you need, a state list to try to figure out, who in your state, knows and understands CRPS, please, send us a message here on Facebook or send us an email at info@rsds.org. You can also reach out there if you need a support group or just anything else from RSDSA. That is all for this evening, and we will catch you all in May. So have a good one, everyone.